She is alone. She is afraid. And the pain is unlike anything she has ever known. But Allah, in His infinite mercy, did not leave Maryam, peace be upon her, without guidance at the very moment of her greatest trial. He did not tell her to endure silently. He told her to eat, to drink, to shake the palm tree. And in that divine instruction, He revealed the very chemistry of childbirth to the world. The Prophet, peace be upon him, preserved that wisdom for every woman who would follow. He gave her a protocol. He gave her food. He gave her words. And He gave her a community. Today, modern obstetrics is finally catching up. But the mothers of the Ummah have always known. Stay for number one, the fruit that the Creator Himself prescribed to the most honored woman in all of creation. Before we begin, we have gathered the daily practices of the Beloved, peace be upon Him, into one book, the Sunnah Home Manual, 40 practices, every hadith verified. Now let us return to the birth story. Let us return to the science of labor, and let us honor the 5 prophetic ways that every mother deserves to know. Let us begin with number 1. Eating dates during labor. This is the most powerful prophetic instruction for childbirth, and it is the only food that Allah Himself explicitly mentioned in the context of giving birth. In Surah Maryam, the Creator says, "And shake the trunk of the palm tree towards you. It will drop upon you fresh, ripe dates. So eat and drink and be comforted." This was not a casual suggestion. This was a divine prescription, and the Prophet, peace be upon him, confirmed it in his practice, advising women in labor to consume dates. But why dates? What do they do that no other food can replicate? Let us look at the clinical science. A 2017 study published in the Journal of Obstetrics and Gynecology found that women who consumed dates during the final weeks of pregnancy experienced significantly shorter labor times. They required less medical induction. Their cervical ripening was notably more advanced upon admission, and a 2022 meta-analysis published in Reproductive Sciences confirmed that date consumption reduces the need for artificial oxytocin, the synthetic hormone used to augment labor. How does this happen? Dates contain tannins and flavonoids that stimulate uterine contractions. They also contain prostaglandins, which soften the cervix and prepare it for dilation. And the natural sugars provide the energy a laboring woman desperately needs for the exhausting process of delivery. The Prophet, peace be upon him, did not know the word prostaglandin, but he knew the fruit that Allah had placed in the desert. He knew it was there for the moment of greatest need. Picture Maryam, peace be upon her, alone beneath the palm tree, the pain of labor gripping her, and Allah instructing her to shake the tree and eat. He did not tell her to endure. He told her to nourish. And in that nourishment, He placed the mechanism for her relief. If you are preparing for birth, ask your midwife about dates. Seek out the adwa of Medina, or the fresh kalas, or the pressed medjool. But do not ignore this sunnah. It is the fruit of delivery. Number 2. Tahneek, the practice of placing softened dates on the newborn's palate. This is one of the most beautiful and most scientifically profound prophetic traditions. The Prophet, peace be upon him, would perform tahneek on every newborn presented to him. He would take a date, chew it until it was soft, and place a small amount on the roof of the baby's mouth. This was not merely a blessing, it was a biological intervention. And modern microbiome science has validated it completely. When a baby is born, their gastrointestinal tract is sterile. The very first bacteria to colonize it come from the mother's birth canal, from the skin, and from the environment. But what if you could introduce a beneficial, species-specific microbe from the very first moment? The sugars in dates feed the good bacteria. The antioxidants protect the developing tissues. And the act of sucking the sweet paste stimulates the rooting and swallowing reflexes, essential for successful breastfeeding. But there is a deeper prophetic layer here. The Prophet, peace be upon him, would choose a righteous person to perform the tahneek, and he would make dua for the child. The spiritual and the biological were inseparable in his practice. He understood that the child's health was not just about food. It was about community. It was about blessing. And it was about the first taste of sweetness coming from a righteous heart. Imagine the birth gatherings of the Sahaba. The father would bring his newborn to the Prophet, and the Prophet would take the date, soften it, and place it in the tiny mouth. The child would suckle, the baby would settle, and the first words it heard would be words of prayer. That is Tahneek. It is microbiome science. It is spiritual bonding, and it is a sunnah we have largely forgotten in the age of hospital births and sterile environments. If you are blessed with a new child, perform Tahneek. Choose the sweetest date you can find, chew it until it is soft, place it on the baby's palate, and make dua. You are not just following a tradition, you are inoculating your child. You are feeding their microbiome, and you are connecting them to the Prophet, peace be upon him. Number 3. Duas for ease in labor. The Quran contains powerful supplications that are directly relevant to the experience of childbirth, and the Prophet, peace be upon him, taught his companions specific prayers for ease, relief, and safety during delivery. The most profound of these is the dua of Maryam, peace be upon her, herself. She cried out, "Would that I had died before this, and been in oblivion, forgotten." And Allah did not rebuke her. He answered her, He sent the stream, He sent the dates, He sent comfort. The Prophet, peace be upon him, taught us to recite the following during labor. There is no deity but you, exalted are you. Indeed, I have been of the wrongdoers. This is the dua of Prophet Yunus, peace be upon him, from the depths of the whale. It is the dua of extreme distress, and it is the dua that unlocks relief. But why does this matter scientifically? The stress response during labor is driven by cortisol and adrenaline. High levels of these hormones can stall labor, slow dilation, and increase the perception of pain. Conversely, the relaxation response, driven by the parasympathetic nervous system, facilitates the release of oxytocin, the hormone of labor. When a woman recites Quran, when she makes dua, when she remembers Allah, her heart rate slows, her breathing deepens, her muscles relax, and her labor progresses. This is not spiritual bypassing, this is physiology. The Prophet, peace be upon him, understood that the soul and the body are one. If the soul is anxious, the body cannot release. If the soul is calm, the body opens. So he gave her words, he gave her verses. He gave her the remembrance that silences fear. Imagine a laboring woman in the heat of a Medina noon. The midwife is with her. The women are gathered, and they are reciting Ayat al-Kursi. They are reciting Surah al-Fatiha. They are whispering the dua of Yunus, peace be upon him. The mother's body responds. Her cervix softens, her contractions regulate, and her baby descends. This is not magic. It is the Sunnah of the heart, and it is available to every woman. Now, let me pause here and ask you something, and I want you to be honest. How many Muslim women do you know who have been prepared for labor with these prophetic practices? How many have been told about dates, about Tahneek, about the power of dua in the delivery room? Most of us have been given a hospital gown and a list of medical interventions. We have been given epidurals and induction schedules and fetal monitors. But we have not been given the Sunnah. We have been separated from the tradition of our grandmothers, the women who knew how to birth with faith and food and community. I want you to share this video with a pregnant woman. I want you to tell her that Allah has given her a protocol, not a medical protocol, a prophetic protocol. And I want you to ask her in the comments which of these 5 practices she plans to incorporate into her birth. Because the Sunnah is not dead, it is waiting. It is waiting for you to claim it. Now let us continue, because we have 2 more prophetic treasures to uncover. Number 4. Maintaining modesty and a spiritual environment during childbirth. This is a practice that has been almost entirely lost in the modern hospital system, yet it is foundational to the prophetic approach to birth. The Prophet, peace be upon him, emphasized the importance of modesty, even in the most vulnerable moments. He taught that Allah is modest and loves modesty, and for a laboring woman, the environment she bursts in directly affects her ability to relax, to open, and to deliver. Today, Hospital birth rooms are often cold, clinical, and filled with strangers. The lights are bright, the monitors are beeping, the interventions are continuous. And the mother's stress response is activated, releasing cortisol and adrenaline that can slow or stop labor. The prophetic alternative is radically different. The prophet, peace be upon him, encouraged the presence of trusted female relatives and midwives. He discouraged the presence of non-mahram men. He understood that a woman needs safety, familiarity, and dignity to birth well. But it goes deeper than modesty. The prophet, peace be upon him, also instructed that the adhan be whispered into the newborn's right ear and the ikama into the left ear. The first words a child hears are the words of Tawheed. The first sound is the call to prayer. This is not merely a spiritual ritual, it is a neurological priming. The newborn brain is highly receptive to auditory stimuli. The rhythm, the melody, and the meaning of the adhan create a sense of safety and familiarity. It imprints the sound of faith onto the developing mind, and it reminds the mother, in the midst of her pain, that this child belongs to Allah. Imagine a birth in the courtyards of Andalusia. The mother is surrounded by her sisters, her mother, her trusted midwife. The room is warm. The lighting is soft. The Quran is being recited softly in the background, and when the baby emerges, the father or the grandmother whispers the adhan into the tiny ear. The baby settles. The mother weeps with relief, and the community rejoices. That is the prophetic environment. It is not about rejecting modern medicine. It is about reclaiming the spiritual container that modern hospitals have stripped away. If you are planning a hospital birth, take control of the environment. Request dim lighting. Request minimal staff. Request that only your husband or your female support person be present. Play Quran through speakers or headphones. And when the baby arrives, whisper the adhan yourself. You have the authority, you have the Sunnah, and you have the right to birth with dignity. Number 5. The prophetic postpartum protocol. This is the most comprehensive and most neglected aspect of prophetic childbirth. The moment of delivery is not the end of the journey, it is the beginning. And the prophet, peace be upon him, gave detailed guidance for the postnatal period, from breastfeeding to akika to the community's role in supporting the new mother. Let us start with breastfeeding. The Quran commands 2 full years of nursing, and modern science confirms that exclusive breastfeeding for the first 6 months protects the infant from infections, allergies, and developmental delays. But the Prophet, peace be upon him, went further. He instructed that the mother be given nourishing foods, particularly dates and honey, to support milk production. Dates contain iron, calcium, and complex carbohydrates that replenish the mother's depleted stores. Honey provides antibacterial properties and easily absorbed sugars. Together, they support lactation, energy, and immune function. Then there is the akika. The Prophet, peace be upon him, instructed that on the 7th day a sheep or goat be sacrificed for the newborn. The child's hair is shaved, and the weight of the hair in silver or gold is given in charity. This is not an outdated ritual. It is a social safety net. The akika brings the community together. It provides meat for the poor. It creates a celebration that honors the new life. And the act of giving charity from the very beginning teaches the family that children are a trust from Allah, not a possession to be hoarded. Finally, the Prophet, peace be upon him, instructed the community to support the new mother. He said that whoever visits a woman after childbirth and helps her, it is as if he has performed a righteous deed. The first 40 days of a mother's life are the most vulnerable. She is exhausted. Her hormones are crashing. She is bleeding and sore, and she needs food, rest, and care. The prophetic community understood this. The women would cook for her. They would care for her older children. They would sit with her and listen to her fears. The modern mother is often isolated, alone, and expected to return to normal life within weeks. The Sunnah says no. The Sunnah says protect her, nourish her, honor her, because she has just passed through the gate of death to bring forth life. Picture the kitchens of the Sahaba. The women are preparing harissa and dates and warm soups. They are carrying baskets to the mother's home. They are holding the baby so she can sleep. They are reminding her that Allah will reward her for every contraction, every feed, every sleepless night. That is the prophetic postpartum. And it is the most beautiful, most generous, most forgotten Sunnah of all. For 1400 years, this wisdom has been passed from the Prophet, peace be upon him, to his companions, to the midwives of Medina who knew the date palm and the whispered dua and the warm embrace of community, to your grandmother's birth stories, the ones she told in hushed voices, the ones that carried the scent of olives and honey and the sound of the adhan. Now, science is catching up. It is confirming what we already knew in our hearts. The dates that shorten labor, the Tahneek that seeds the microbiome, the duas that calm the anxious heart, the modesty that protects dignity, and the postpartum care that sustains the mother through her most vulnerable days. But let me be absolutely clear. The cures Allah has placed in His creation are not miracles, and they do not replace your doctor's care. They are the means He has given through the Sunnah, and they are blessings. If you are pregnant, consult your obstetrician before beginning any new dietary or herbal protocol. If you have gestational diabetes, discuss date consumption with your healthcare provider. The prophetic medicine is not a rejection of modern obstetrics. It is a complement to it. It is the foundation upon which we build our birth plans, trusting in Allah while taking the means He has provided. Now, if you want to explore this further, I urge you to watch our video on the science of honey in the Sunnah, the liquid that the Prophet, peace be upon him, said heals sickness. The modern research on antimicrobial and wound-healing properties will astonish you. That video is waiting for you. Click it now, and continue this journey into the prophetic science that heals body and soul. May Allah grant you and your family complete shifa. May He bless every woman who prepares for birth with the knowledge of her faith. May He ease every labor, and may He grant every child a righteous beginning. Assalamu alaikum.